So today we're here with Dr Shiromi. She's a GP in the mental health space. We've done a 3-part series covering all of the questions you might have engaging with a GP. So we're looking forward to sharing it with you today.
So first, let's just acknowledge that seeing a GP for your mental health is really tricky. It's really complex. You're in a very vulnerable state when you come in to talk to us about your mental health. So let's normalise those feelings, and we understand that as being your clinician. I think the key here is that we need to reframe how we view mental health. Often we see our mental health as something we need to fix ourselves. We can feel like a bit of a failure if we haven't fixed the problem, when actually we need to think about it like we think about any other health disorder or chronic illness. Diabetes, asthma, appendicitis. I've never had a patient come in to see me for appendicitis and feel guilty for having appendicitis. They come in, explain their symptoms, and then together we work collaboratively to come up with an action plan. The same needs to go for mental health. It's a medical condition. You need often expert help to help you get through it. So the key here is to reframe it. The second thing I think we all need to do is we need to have a culture change. We need to talk about mental health, acknowledging that it is a medical condition. So if someone talks to you about their struggles or their worries, it's important to validate them and make them feel heard, and then encourage them to get professional help. So I've been a doctor for 15 years and I'm a GP, a fellow of the Royal Australian College of General Practitioners, and for most of that time I've been doing mental health, and I have never had a patient come in unnecessarily to have a chat about their mental health and their well-being. Often it's quite the opposite. Often they come in to see me at crisis point when things are really not too great and they're up the creek. So their marriage might be on the rocks, maybe they've been called in for a performance review with their boss, or they just feel like a shell of themselves. Often I find myself thinking in my head, bugger, I wish this person had come in earlier, because it sounds like they've been struggling for months, if not years, by themselves, when there is so much that we could have done as a GP to help them. Most certainly, I'm happy to look after anyone at any end of the spectrum, whether it's early on or later, but it is so much easier to give you help if you come in earlier. So my advice to everyone would be to come in when you think that there are cracks. It's hard to figure out whether you are having a rough day, a rough week, or whether you've got diagnosed depression or anxiety. But the point is, you don't need to worry about it. That's my job as your GP. So leave the diagnosis and medical work up to me. Come in and let's just have a chat. Yeah, of course it's normal. It's a really scary thought to even discuss these things. Often you're feeling very vulnerable and a lot's been going on. And sometimes you come in and you're feeling a bit ashamed and feeling full of guilt and failure that you weren't able to fix this yourself. That's hard enough to have a chat with a friend about, let alone someone that you may not have met before. So yes, it is completely normal to feel worried and a bit scared and apprehensive. I think there are a few things that you can do to help yourself. One of them might be to bring in a friend or a family member to help you with providing us with that history and answering those questions. Another would be to book a double appointment or a long or extended appointment with a GP, and this way you're not feeling time rushed to articulate everything really clearly in a short space of time. You've got some time to slow down and relax and connect and discuss things with us. And the other thing is to prepare. I know for me, it helps me when I know what questions I'm going to be asked. We've got a great download for you, our GP Conversations resource, that goes through and lists some questions your GP is likely to ask. So you can go through it and get a heads up on what we're going to ask, and also, I suppose, not feel like a bunny in the headlights when we do shoot all those questions at you. It's really important to connect with a GP and find someone that you view as almost a friend. It's really hard to come in and talk about mental health stuff. You're feeling vulnerable. You're often worried that you're going to be judged and we might be critical of how you've, played things so far. And that is not the case at all. We are here to help you and to try and come up with an action plan to get you feeling better. I think that, it's hard to talk about mental health. And when you're looking for a GP, ideally, you know someone. So you've set up things so that you've got a great GP already. And you're going in to see them as a friend. Have a think about what you need when you're going to see a GP. Do you need someone with an energetic, motivated personality, or do you want to see someone with that sort of softer, nurturing approach? And trying to find points of connection is really important when you're trying to find a great GP. I wish they did. I wish people came in to see me for their mental health when they first saw cracks or had worries, but often that's not the case. Often people wait and try and manage this themselves because there's such a stigma attached to mental health and seeking help for your mental health. I always say to my patients, it is so much easier for me to help you if I can reach your hand. If the hole isn't too deep, I can just pull you out. Now, most certainly, if you're at the other end of the spectrum and you're in a deep hole, I've got ladders and pulleys and ropes to pull you out, and I can most certainly help. But it's so much easier to help you at those early stages. We've got to start thinking about mental health and how we manage it from a proactive standpoint, from a preventative standpoint. We don't want to wait for you to be feeling really awful before you see us. We want to get in there when things are a little bit rocky and help you improve things with some really basic and easy to implement lifestyle interventions, some psychology help, and have a chat and go from there. So it's important to find a GP that you connect with, because that'll make the consult feel a little less intimidating. We've got to acknowledge that when you're going to see a GP, it's a lot more than finding someone with the right professional qualifications on the wall. You want to connect with this person one-on-one so you can be honest and be upfront about how you are feeling and what your struggles and concerns are. Have a look at practice profiles and read about different GPs. Have a look at what their interests are, what their medical interests are. You might want to see someone young, someone older, someone with, specific special interests. You might want to see someone that has got sort of an advocacy role in the LGBTQIA arena. You may want to see someone that has a certain personality type. I know for me, I've got a patient who looked at the practice profile and saw that I had a beautiful Labrador named Snickers, and she's a dog walker. So she comes in to see me about anxiety, and when she's feeling a little bit anxious and worked up, we often have a little bit of an icebreaker chat about my pup Snickers and what naughtiness he's been up to. So find someone that you connect with and have a think about what's important. Language, cultural background, these are all factors that play a role. Yeah, it's not uncommon to see friends of friends as a GP when consulting. And the reason for that is if your friend gets along with someone, chances are you're going to vibe with them as well. Having a chat to friends about who they see from a GP point of view is a great way of finding a great GP if you haven't got one already. Often I'll see someone, then I'll see their friend, and then I'll see their mum or their partner and see their cousin. That's a really normal situation to find myself in. You need to remember that all of that is protected by doctor-patient confidentiality. We don't go sharing your health information. But if you're looking to find a GP, have a chat to your friends and see who they see. Also, if you've got a great GP, share the news with your mates so that they can, connect with someone that they're likely to get along with as well. Look, reception is a bit of a secret untapped resource, to be honest. If you're trying to find a GP, it's always a good idea to have a chat to them if you want someone with a certain personality type. Our receptionists work with us one-on-one. They have lunch with us every day. They see us consult patients. They see us sort out emergency situations, and they know what we're like in general. So the other thing to note is that they get the goss out the front when people go out to sort out their appointment details. So have a chat to reception and let them know that you want to see someone that's fun and energetic and younger, or someone that's got that soft, nurturing approach. Other things to consider are logistics. So we want to make your consults as easy as possible from a preventative health point of view. We want you to find a clinic that you can get to easy. So somewhere close to work or somewhere close to home, someone that's got car park or maybe has easy access through PT. Think about all those logistics to make it easy for you. In the long term, we want you to be doing proactive measures to look after your mental health. So that means not just coming in when things are bad, but coming in when you're well to stay mentally well. To do that, we will probably organise regular mental health appointments. If we make it hard and you've got to drive out to Whoop Whoop, you're probably not going to come in. So make it easy for yourself. Think about whether there's weekend access or after hours access, how much things cost, whether there's pathology or a psychologist on site, to make life easy for yourself. It's really normal to feel really intimidated about discussing your mental health. I think one of the key tips is to open with a statement like, "Hey doc, I've come in to see you about my mental health today. I booked a double appointment," and then we know that's the agenda. If you kind of slip in that you're struggling with your mental health in between the chat about contraception and your skin, it can sometimes be hard to know whether that's something you actually want to sort out or it's a passing comment. So my number one tip is book a double appointment and open with that really strong statement of that's what you've come in for. My patients who see me regularly for mental health, they know I have a little bit of a rule. So unless there's an emergency, they are there to only discuss their mental health. I think as clinicians and as patients, we all have this little thing that we do where sometimes we sort out all the medical stuff first. So we have a chat about your sore knee and we have a chat about your migraines and whatever else. And then at the end of the appointment, the mental health stuff comes up, and inevitably there's not enough time and that topic gets rushed. Now, if we don't spend the time and energy to listen to you and provide you with patient-focused care and advice, we don't get good outcomes. So we really need to start giving mental health the time that it deserves if we're going to sort this out properly. It also helps to be prepared, to know what your GP is going to ask so that you don't feel so intimidated. So there's a wonderful resource called GP Conversations resource, which you can download, and that goes through some really common questions we as GPs ask so that you know what you're in for. It is really important to share your goals with your GP And the reason we do that is that we get good outcomes when we focus care around what you want to achieve. I might have my objectives as a GP of achieving X, Y, Z, but if you think about what you want to achieve and we plan treatment strategies through lifestyle, psychological interventions to get that goal, then we're going to have good outcomes. My favourite appointment is the mental health review, which we do 3 to 6 months after you come in to see me for a mental health care plan, where we reflect and review on how you're doing. And it is the absolute best when someone says to me, yeah, look, my relationship with my partner is so much better. We're going out for date nights on Fridays and we're connecting and communicating properly. That's the sort of stuff that drives you to keep doing all the hard things that you need to do to keep on top of your mental health, whether that be diet, exercise, sleep changes, whether it be remembering to take a tablet or to attend your psychology appointments. So yes, think about your goals, think about what you want to achieve, and then share it with us so that we can use that moving forward in terms of managing your mental health.